Hello, my name is Dr. Diwan S. Raja. Today I will discuss about tetanus. Tetanus is caused by Clostridium tetani, a spore-bearing gram-positive bacteria. This bacteria is abundant in the environment, particularly in the soil. Spores are highly resistant to light and temperature. Spores germinate under anaerobic condition and produces two toxins, tetanolysin, tetanospasmin. These toxins work on the neurotransmitter as well as they ascend through the blood vessel as well as the nerve axons to the central nervous system, to the spinal cord, brain, and also to the autonomic nervous system. Transmission occurs when a wound, cut, burn, or lacerated injury or just penetrated injury that is very common, contaminated with dirt, human or animal excreta or saliva. Occurs most commonly in rural areas with poor sanitation. Cultural rituals like painting the umbilical cord with cow dung and poor immunization programs. So this is a disease caused by infection by the Clostridium tetani. This is a spore-bearing gram-positive bacteria. Okay, so if you look at the picture, this picture has been taken from Microsoft PowerPoint online. This is drawn by Dr. Netter. Okay, we are seeing the wound, penetrating wound here. It is contaminated with soil most likely, and in the anaerobic environment, this organism, Clostridium tetani, gram-positive spore-bearing rod, the spore will germinate, and that will go through the nerve axons or through the blood vessel, the spinal cord, brain stem, brain. Okay, so this is the way, and it inhibits the inhibitory neurotransmitter like glycine, gamma aminobutyric acid, and it will excite the central nervous system. So there will be convulsion, trismus, and Risus Sardonicus. The masseter muscle is very much taut. Person cannot open the mouth and eyelid going up here. Okay, this is very much taut. And this is Opisthotonos, almost like a bow-shaped condition. Sometimes the heel touch, head touch, this body goes up just like a bow. This is the Opisthotonos. So these are the features of tetanus. Eventually there may be dysphagia, dyspnea, person may be cyanosed on each convulsion, and there may be respiratory failure and death that is also possible, and the case fatality rate is very high even in most modern hospital. Okay, clinical presentation, just we have discussed. Our incubation period is 3 to 21 days. It is a little bit variable. Acute symptoms include muscle rigidity, spasm often in the jaw and neck, trismus, Risus Sardonicus, and Opisthotonos. Symptoms may be localized, may be confined to the head and neck region, may be confined to a few cranial nerve like facial nerve, or may be generalized convulsion. Entire central nervous system may be excited because suppression of the inhibitory neurotransmitter like glycine and gamma aminobutyric acid. Autonomic dysfunction will happen, and there will be hypersensitivity to light or noise. Severe tetanus may lead to respiratory failure and death. Case fatality rate is very high, even in hospitalized patients. Okay, so how can I diagnose tetanus? Tetanus diagnosis mostly made by clinical features. Okay, so it is diagnosed clinically. Treatment, certainly patients should be in the hospital. There will be aggressive wound care or debridement with that of hydrogen peroxide, and it should be cleaned properly. Human tetanus immunoglobulin, tetanus toxoid booster, anti-spasmodic drug like hyoscine and butyl, metronidazole, especially for anaerobic, this is anaerobic condition, so metronidazole will work good. Also, we may need benzene penicillin. Prevention, completion of childhood vaccine series. There is a must. Tetanus toxoid at adolescence and then every 10 years. A booster dose of tetanus toxoid if a wound is contaminated. It may be not necessarily it should be 10 years. It may be when there is a lacerated wound or penetrated wound and apparently there is chance of tetanus. We should get one booster dose of tetanus toxoid. Immunization during pregnancy to prevent neonatal tetanus. So if the mom is immunized during pregnancy, then the neonate will not have tetanus, most likely not. Better obstetric care, practice and care of umbilical cord. Umbilical cord should be cut by sterile scissors. Okay, it should be tied with the sterile thread. So never use soil or any other thing to the umbilical cord stump. That may be infected, that may lead to tetanus, neonatal tetanus. Okay, that's all about tetanus. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.